Hi and welcome to Hoxton Therapy. This is a narration of one of our articles. Mild depression. Most people around the world will often wrongly assume that mild depression does not have to be treated. A large number of people also incorrectly assume that this condition is not serious at all. They think that it is okay to brush it aside and try to forget about it. They think that nothing is wrong. However, with all that in mind, mild depression can very easily be confused with subclinical depression. In other words, the condition has not yet reached that fully blown stage of depression. People might also wrongly think that mild depression will not come under specific criteria to be formally diagnosed, but actually you will be surprised to learn that it will. The truth of the matter is that those who do not have mild depression do actually fit in specific criteria for major depression. After all, they do experience depression. The main difference is that the symptoms they are experiencing are not as severe as those with other forms of depression. The impairment and intensity are much more mild. Depression is in fact an illness. It can come in a wide range of different types of intensities. This particular condition can also come to people of all ages, of all genders, and of all cultures. Some of these intensities will be remarkably profound, other intensities will only be mild, others severe, and others just moderate. Each of these specific intensities are worked out through learning how severe the symptoms are and how much they have an effect on a person's day-to-day activities. They are also determined depending on whether or not the individual can or cannot do everyday chores they would normally do around their home. They would have to get someone else to do them all the things that they would usually do for themselves that they cannot manage anymore. When it comes to this type of depression, the major symptoms to look out for may include constant negative thinking, irritableness, too much fatigue and tiredness, a state of hopelessness, constant crying and helplessness. These can also not be as obvious as other symptoms. Somebody once said, when a person experiences mild depression of all kinds, it will seem as though these people are much archier than normal. They will also be moodier than normal, and they will also feel a lot more tired a lot of the time. Then there are those people who do not even know that they have some form of depression. They do not understand what it is or what the symptoms to look out for are. Yet the people around them can recognize that these people are having a hard time. However, these people do not have the ability to get through the day. Getting through the day does not require much effort on their behalf. Within that mind, there are several major health risks that we should all be aware of. A few of these risks may include the following: premature mortality and cardiac problems. It has been said that there are a few types of mild depression that can disappear very quickly. An individual may have experienced unemployment, a divorce, financial difficulties, or an illness of some kind. Other people may have chronic depression. This type of depression can go for a very long time, perhaps even as long as 10 years for a person's whole life. There are also a range of other types of depression that can often turn into severe or moderate depression. This can happen quicker than what we can think. Not only that, but it is possible a person could end up experiencing a double type of depression. It was once said double depression will often take place when mild chronic depression will get more difficult to handle than what it originally was. So much so that the individual will not be able to recover from it. Studies have proven that there are as many as 75% of individuals who have dysphoria disorder. These people are likely to get the double depression at some stage in their life. It was discovered that when teenage women have children, that early treatment can assist them greatly. Some teenagers will also have witnessed the effects of double depression in other people around them as well. This means that it is absolutely vital to seek help as soon as you can. A person may start having time with their primary care physician. During this time, they will be required to have physical examination. The examination will allow professionals to determine whether or not other medical conditions are involved. Sometimes other medical conditions can cause mild depression. After this, a person with mild depression will then need to see a mental health professional. This professional will screen this person for this condition. Whilst this is happening, you will soon be able to know that the problems are that they're resulting in mild depression. You will be able to work out how you can deal with it and how to learn how to control and manage it in better ways. There are a number of different things that can be used for treating people who have mild depression. Some of these things include exercise, light therapy, holistic measures, and aromatherapy. Research has shown that yoga in particular is a great form of exercise that can lessen the symptoms that a person with mild depression may be experiencing. The power of exercise and managing depression can be incredibly profound and powerful at the same time. Please always keep in mind that mild depression can at any time turn into a very serious condition. It is vital that an individual with this condition get an evaluation done as soon as possible. Once this is done, they can begin treatment very quickly. It was said the important thing to remember is that one should learn how to manage the symptoms as early as possible. Come up with some approaches that can be used to stop other symptoms to come or other illnesses to build up. If you know that your mild depression is causing you to want to die, yet does not quite fit under the criteria for major forms of depression, then consider fitting extra exercise in. Socialize as often as you can and do some cognitive behavioral therapy. Do not put this off. Begin them as soon as you are able to. If you are noticing the symptoms you are experiencing are lasting for a whole day or up to 1 week or longer, the chances are you can be formally diagnosed. It is likely that you will have regular depressive disorder. This type of illness is often understood to be dysmia. Whilst mild depression can be seen, it can be very hard to formally diagnose. It is easy to ignore any symptoms a person may be facing. The person may also not want to talk about them with their professional doctor. Even though this type of depression can be hard to diagnose, strangely enough, it is very easy to treat and manage. More often than not, all a person with this condition needs to do is to create some simple changes in their life. This can have a major effect on increasing the serotonin levels in their brain. As a result of this, depressive symptoms will soon begin to disappear very quickly. When a person suspects they have mild depression, it is vital to make an appointment with your professional doctor as soon as practically possible. The doctor will be able to formally diagnose you with the condition. Once this has been done, they can suggest and provide suitable treatments to help you look after and manage your condition. Some treatment suggestions may include making changes to the way you live, SSRIs, CBT, or herbal remedies of all kinds. Sometimes a person may be in a bad mood because they don't have much energy. They will constantly be saying they do not want to see other people in their lives. Whilst we are dealing with mild depression in this article, or this recording, it is worth having a think about moderate depression. This type of depression is what comes next from the mild form of depression. Each of these types of depressions have symptoms that are much the same. However, the thing that may come from moderate depression may include a person may worry for far too often. More often than what any normal person would worry about. They will not be as productive as they might have been in the past. They will have difficulties with their self-esteem. Those who have moderate depression will also have a greater amount of sensitivity in their life. They will also feel like they are not worth it, and that it is not worth doing such and such anymore. The main thing to keep in mind with moderate depression is that its symptoms will be enough to result in difficulties and issues both at work and at home. A person's social life may also begin to experience a wide range of problems. Doctors find it much easier to diagnose moderate depression. This is because the symptoms that come in, it will have a major effect on the person's everyday life. The important thing to remember when getting your condition diagnosed is to always discuss the symptoms with your professional doctor. Only they will be able to do the diagnosis for you. The things to look out for with severe depression include some of these: behaviours and thoughts that will cause a person to want to kill themselves. A person will feel stupor all of the time. They will experience hallucinations and delusions of all sorts. When experiencing these types of symptoms, a person will need to get treatment straight away. However, never ever put this off because it could only end in serious disaster. Nobody wants to experience disaster in their life that can be prevented and controlled. If you suspect that you or someone you know is continuing to have problems in you or their life, when you cannot help yourself or others cannot help you, then see your doctor as soon as you are able to. Suggest to the person that you know to see their doctor as soon as they can. Always keep in mind that getting treatment of whatever kind, you will need to be able to connect with them. Connecting with the right person will be much better than working with someone you do not connect with. The treatment will also be much more powerful and successful. Even if you are only experiencing a few symptoms, there are a few symptoms that can easily be missed. Sometimes only a doctor will be able to tell you whether or not you have some sort of depression. Always be aware that treatment can take quite a while before you can see if it's working or not. Simply making an appointment with a professional doctor is a great start to recover from your illness. In this article, or this recording, we have seen that there are many people can assume that mild depression does not have to be treated. They could not be more wrong. All forms of depression, no matter what type it is, must be treated as soon as possible. We have also seen that mild depression symptoms include irritableness, overtiredness, constant negative thinking, constant feelings of helplessness, lots of crying, and the person always feeling as though they are hopeless at everything in life. It is also possible for an individual with mild depression to experience double depression. Some mild depression can go away very quickly, but others can take a long time to go away. Some people will require a new, different form of therapy, medication, and exercise to help them recover from their conditions. Others will simply need to make a few different changes to their lifestyle to help them get through this. It is very easy to ignore symptoms of any form of depression. Never ever ignore these. Once you feel as though you may be experiencing them, please make an appointment with your professional doctor as soon as you are able to. If you are too afraid to do that, contact an emergency service or hotline. These people will not know who you are or what you look like, yet they will be able to provide some sort of assistance to help you get through the feelings and symptoms you are dealing with. Never ever be afraid to reach out and contact these people if need be. You will be pleasantly surprised as just how good they are and can be for you. Why not get in contact with them right now? Or book an appointment with us at Hoxton Therapy. Hi, we hope you enjoyed that narration of one of our articles on our website, hoxtontherapy.com. As usual, we have our podcast, which answers your question, and the name of the podcast is the Ask Hoxton Therapy Show. You can ask us questions on social media, and we will answer those questions in upcoming either video content, and of course, when our video content's done, our podcast content audio is done as well. So stay safe out there. It's COVID-19 at the moment. Till next time, goodbye. Never act on any advice given in these articles, videos or audios. Always seek professional help before acting on anything you read or watch or listen to on this website, or in our podcast, or on our YouTube channel, or anywhere on our social media.